Hi, good morning, everyone. My name is Nadia. I'm one of the physiotherapists at National Heart Centre. Thank you for coming for the forum today. So today, I will be explaining regarding the importance of exercise in managing and controlling blood pressure, share with you some simple, effective exercises for different fitness levels, as well as tips on how to exercise safely. So these are the categories of blood pressure based on the MOH clinical practice guidelines. So I think Dr. Rizwan has also explained before. Hypertension is defined as systolic blood pressure above 140 as well as diastolic pressure above 90. So normal blood pressure would be systolic blood pressure less than 130 and diastolic blood pressure less than 85. Okay. So there are many risk factors of hypertension. So these are some of them. Today we'll be focusing on physical inactivity because it actually affects the body's ability to regulate blood pressure by hindering the healthy blood vessels elasticity as well as efficient blood flow. Sorry, I think the slides are like going a bit too fast. Okay, so physical inactivity also affects obesity, which is another risk factor for blood pressure, high blood pressure. So as part of controlling blood pressure well, you should do some form of exercise that will also help to maintain a healthy weight, as well as helps with stress management, so which is another way that can help to control blood pressure as well. So how does exercise help to control blood pressure? So firstly, exercise helps to strengthen the heart. So secondly, it helps to improve blood circulation, helps to maintain a healthy weight, as well as it reduces stress. Okay, so impact of exercise on blood pressure. Exercise actually leads to a 5 to 8 mmHg reduction in blood pressure. This actually is a clinically important reduction because it contributes to reducing the risk of coronary heart disease by 4% to 22% and stroke by 6 to 14% among adults with hypertension. However, at least 6 months of exercise training is needed for you to see benefits. So it's actually important to maintain a regular exercise program, not just to exercise once in a while, okay? So how does blood pressure changes with exercise? At rest, your blood pressure is actually controlled by how much blood the heart pumps, as well as the resistance in your blood vessels. When you exercise, heart rate and blood pressure will increase to send more oxygen-rich blood to the muscles that are actually involved in the exercise. So blood pressure usually will increase slightly during the exercise itself. After you stop exercising, your heart rate and blood pressure gradually lowers as your body calms down. Blood can pool in the lower body, which can actually cause a temporary drop in blood pressure. This is called post-exercise hypotension and may last up to 22 hours post-exercise. So what are the recommended exercises? First, we have aerobic exercises. So aerobic exercises are exercises that involve large muscle groups, are rhythmic in nature, and helps to promote cardiovascular endurance. So some examples are walking, dancing, treadmill walking, cycling, or swimming. So as examples of how you can actually incorporate aerobic exercises into your lifestyle would be, for example, walking along the park connectors or around your neighborhood. Dancing or Zumba classes are actually available at a lot of the CCs. So that is actually an alternative to walking as an aerobic exercise. So swimming is actually a good aerobic exercise to do as well, which you can do in across this neighborhood swimming complexes as well. Cycling is another exercise that you can do, which may be a little bit easier for some of patients, especially those with joint pain that cannot walk, that affect your walking ability. Okay? So aside from aerobic exercise, you should also conduct resistant exercises. These are exercises actually to strengthen your muscle strength. We should be aiming for exercises that affect the muscles that are used in a lot of our daily activities. So the majority of the muscles that we are using are the chest muscles, the arm muscles, the buttock muscles, and the leg muscles. So examples of the muscles are like the biceps muscles, which are your arm muscles here, your quadriceps muscle, which are your thigh muscles, the gastrocnemius, which are your calf muscles, as well as your gluteal muscles, which are your buttock muscles. Okay, so for resistance exercises, these are some examples that you can be doing. Lunges for your legs, squats or sit to stand exercises are actually good exercises to do and effective for the whole body. So shoulder shrugs are another example of some simple exercises that you can do to strengthen your shoulders. Hip flexion, bending your knees and hips high up. Hip abduction, you can do it in lying as well as in standing. And bicep curls, which are for your elbow muscles. So as you can see, the exercises actually you can be done with body weight resistance, so without any extra resistance, or you can actually use TheraBand, which are the exercise bands, or you can use dumbbells as well to help with that. Okay, so what are things to take note of when you're doing these resistance exercises? Let me go through with them few. So number one, you should be able to do the movement through the whole angle of the muscle movement. So if you're carrying a weight, but you can only do part of the movement, it might be a bit too heavy for you, okay? Then for the repetitions, you should be able to carry the weight through 8 to 15 repetitions and 2 to 3 seconds to do the movement, 2 to 3 seconds to relax. If you are carrying a weight that is a little bit heavy, right, you may not be able to do a minimum of 8 repetitions. Then for that, you might need to reduce back the weight, okay? So usually we will advise to start with 8 repetitions, progress to 10, 12, and then 15 repetitions. For sets, how many sets should you do? You should do about 1 to 2 sets at first. Then if you can progress to 2 to 3 sets. So each action, you should have a rest in between each muscle action so that prevent injury to your muscle. And there should be rest days in between the resistant exercises as well so that your body can recover. So this is very important. You must remember not to hold your breath, to breathe out slowly during lifting and breathe in normally during rest, okay? So this is actually to prevent build-up of pressure in your abdomen, prevent stress on your spine, which can cause, back injury if there's too much stress, as well as prevents drop in blood pressure. So a lot of people, they have the misconception that when they carry the weight, they tend to kick a bit and hold their breath. So that's actually not the recommended technique. We want you to breathe out slowly when you're using force and breathe in when you relax. That would actually be the correct technique to do. Okay, aside from aerobic exercises and strength exercises, what else can you do? You should be focusing on some flexibility exercises, which actually include stretches, such as your calf stretch, your hamstring stretch, your quadricep stretch. If you participate in any yoga or Pilates classes, there's also a form of flexibility exercises. So why is flexibility exercise important? Because this will actually help to prevent injury to your muscles as well. So when you are exercising, you're using a lot of your muscle strength. That can actually lead to muscle cramps as well. So it's actually important for you to do the flexibility exercises. You can do them before as well as after your exercise. So additionally, you can also participate in neuromotor exercises such as Tai Chi, Qigong, Yoga, and Pilates. These exercises also help to reduce blood pressure, especially if it helps you to relax and maintain like a healthy lifestyle as well. Okay, so this is a table that will show the summary of what kind of exercise you should do, how often you should do, and what is the intensity. So focusing on the first one, which is the aerobic exercises, each session should take you about 30 to 60 minutes with a minimum of 150 minutes per week. So for example, if you're doing 30 minutes, you need to do at least 5 times a week of exercise. Okay? So the intensity. So there is a difference between the different doing physical activity and exercise. If you are wanting to do moderate intensity exercise, you should be able to talk but unable to sing a song during your exercise. So the next time you do your exercise, you can try to sing a song and see whether can you maintain that song or not. So if you're able to talk in short sentences, that's okay, means that it's a moderate intensity. If someone talks to you while you're exercising, you need to catch your breath, means a little bit too breathless already. If you're walking alone, nobody to hold a conversation with, what you can do, you can count 1 to 15. If you're required to stop more than 2 times, means that you are actually a little bit breathless and the intensity might be a little bit too much for you, okay? So frequency of aerobic exercises should be 3 to 5 times a week. For strength training, we recommend 1 to 3 sets, 8 to 15 repetitions, 2 to 3 times a week as well. For flexibility, you should hold the stretch for 10 to 15 seconds, and each joint should be stretched for each stretch should be done for about 2 times each. And then you should stretch to the point of feeling tightness. It can be done daily as part of your warm-up and cool-down. And then like the neuromotor would be like the balance exercises, the Tai Chi. If you're doing 20 to 30 minutes each section, it's okay. Same thing, intensity, you should be able to talk while you exercise, and it should be done 2 to 3 times a week. So I've actually done up an example of a weekly exercise program. Okay? So for example, Monday to Friday, Sunday, right? You can do warm-up will be a slow walk or stretching exercise. So Monday, maybe you can go for a walk at the park. Then Wednesday, you can do some cycling at the exercise corner. A lot of HDB blocks will have the exercise corners that they have bicycles. Sometimes they have like those stepper machines as well. Then you can also incorporate some balance exercises and some resistance exercises to ensure that it is a holistic exercise program. And for cool down, you can do a slow walk or some stretching exercises as well. Okay? So what are some important tips to take note of when you're exercising safely? We recommend that you monitor your vitals before exercise. So your blood pressure, these are guidelines that we are using here at our center. So for blood pressure, your blood pressure should be between 90 to 160 for the systolic blood pressure, and for diastolic should be within 60 to 90. It is a big range here because we do see a variety of patients. So you have to see what is your normal trend of blood pressure as well. For heart rate and oxygen level, usually recommended is above 95% for oxygen level, and for heart rate, normal resting heart rate is 60 to 100. So the resting heart rate is also dependent on whether you're on any medications that control heart rate, as well as how active you are. So the more active you are, usually the resting heart rate is lower, and if you're a little bit more sedentary, usually your resting heart rate will be higher. As well, for if you are having diabetes, we recommend that you check your blood glucose level before exercise. So recommended range is between 5.5 to 15 mmol per liter. If your sugar level is below 5.5, you should eat a piece of fruit before exercising. If your sugar level is above 15, then we don't recommend that you exercise until your blood sugar level comes down. So, as I've mentioned earlier, how do you know what intensity of exercise is good for you? So if you are doing light intensity exercise, you should be able to speak in full sentences and sing a song. Moderate intensity, you should be able to speak in phrases and short sentences, but unable to sing. And if you're doing vigorous exercise, you might find that you have difficulty in maintaining a conversation or talking during exercise. Okay? So how do you progress your exercise safely? We always try to increase the duration first over the first 4 to 6 weeks, and then increase the frequency and then intensity of exercise. So aim to achieve 150 minutes of exercise per week over the next 4 to 8 months. Okay, so warm-up and cool-down are important parts of your exercise component. Warm-up should be done about 5 to 10 minutes pre-exercise, allows your heart rate and blood pressure to rise gradually, and allows your muscles and joints to gradually adapt to increasing load. This will decrease the risk of injury. The easiest way to do warm-up will be to do a slow walk. Okay? After your exercise, it's also important to do cool down. So lower intensity exercise for another 5 to 10 minutes. It will return the blood back to the heart and prevent blood pressure from dropping suddenly. And it's also helped to stretch the muscles and joint to relieve the soreness. So if you are starting on a new exercise regime, it's always good to consult your doctor before starting on a new regime. Start with light intensity exercise, especially if you're starting a new exercise, and progress gradually. As a guideline, we actually recommend for patients to exercise 2 hours after your meal and after taking medications, okay? So if you are having any of these symptoms, please do not exercise and seek medical attention. So unwell, on antibiotics, experience any chest pain, chest discomfort, shortness of breath, feel pain in the jaw, neck, or down the arm, feeling giddy, having fainting spells, systolic blood pressure more than 160 consistently, diastolic blood pressure more than 90, unusual weakness or fatigue, or having irregular heart rate or fast palpitations. So what is the takeaway message here? So aim for 150 minutes of moderate intensity exercise per week. You can choose to do it at home, in the parks, or in the gyms. And exercise regime should actually include different types of exercise. So if you are unable to do like a full 60 minutes at one go or full 30 minutes, you can actually also do exercise for like shorter duration, but just make it more frequent. So for example, in the morning, you can do 15 minutes walk. Then in the evening, you can do another 15 minutes walk. So the effects are still there, even though you're not doing one shot, like 30 minutes. So you have to progress accordingly based on how you feel and according to your ability, of course. Don't like, if you have not been exercising for a while, suddenly the next day you want to go for a 1 hour walk, that one will be a bit too fast and too soon. So you need to start maybe with 10 minutes walk, slowly progress by 5 minutes every week. So you can do like a 15 minutes, 20 minutes, and then you achieve 30 minutes. Then you start with 3 times a week and progress slowly to 5 times a week to achieve that 150 minutes per week. Okay, thank you very much.